Hello everyone, I hope you are all doing well. My name is Ngoya Nicholas and I'm a pharmacy practitioner. Welcome to this channel once more, and I'm glad that you've joined me today. So as I mentioned earlier in my previous video, I'm going to answer some of the 5 essential questions about anti-inflammatory medications as we saw in the above questions. First of all, allow me to raise this disclaimer. The information in this channel is purely for informational and educational purposes, okay? It is not intended in any way to replace your professional medical advice, treatment, and diagnosis. So kindly ensure that before you make any choice on your health and medication, consult your healthcare provider. First of all, let me explain what inflammation is. An inflammation is a normal body reaction to an insult, to trauma, to an attack or an infection. Okay? So when a bacteria invades your body, the body responds by sending an army of cells to combat and kill the bacteria. So this makes the part of your body hot, red, painful, and swollen. Okay? However, the body tends to overreact in some instances, making the inflammatory reaction much more than needed. Okay? The body overreacts because it is better for the body to send the more inflammatory cells to combat and kill the bacteria than not to send it. Because if it does not send, it means that the body will lose the battle. Hence, the infection will spread throughout your body. Okay? I hope that is clear. So it is better for the body to send more cells than needed. But inflammation doesn't only occur when there is bacterial invasion. It also happens in autoimmune diseases, in fractures, ruptured tendons, commonly known as tendinitis. Basically, any medical term ending in itis indicates inflammation. For example, inflammation of the appendix is called appendicitis. Inflammation in the brain is called meningitis. Inflammation of the ear in the ear is called otitis, and many more. To combat inflammation, we use anti-inflammatory drugs, which comes in 2 types: steroidal and non-steroidal anti-inflammatory drugs, normally known as NSAIDs. Today, I'll focus on NSAIDs. A simple study was conducted based on the question. So the participants were asked the following question: when you are in pain, what do you do? The results were as follows. 37% said they take painkiller medicines, 30% do some exercise, 17% try to distract their mind, and 6% just cry and feel miserable. The remaining 9% mentioned various other methods like drinking warm water, deep breathing, and taking hot water. So, those of you who fall under the 37% who take painkillers to manage the pain, this video is for you. There are dozens of different types of NSAIDs readily available over the counter without a prescription, though a few of them require a physician prescription. Another survey asked painkiller users. So the participants were also asked this question: which painkiller do you take? The results were 48% take paracetamol, 22% take ibuprofen, 13% take diclofenac, and 10% take aspirin. This is the end of this video. I hope you got enlightened and you are better off than before. Please subscribe, share, and like. See you